Hello, everyone, and welcome to The Takedown, our series of unfiltered conversations about tobacco and advocacy within communities most impacted by the tobacco industry. My name is Nicolas Suarez, Program Associate on the Youth Advocacy Team here with the Campaign for Tobacco-Free Kids. And today, we're joined by Jamie Nájera. Jamie, thank you so much for joining us today on The Takedown.
Of course, thank you for having me, and thank you for inviting the National Association of Hispanic Nurses into the conversation.
Of course. So, Jamie, here at the Campaign for Tobacco-Free Kids, we recognize that in the public health space, nurses are trusted messengers. Can you share a bit more about your role as a clinical educator, as well as your role as it relates to the National Association of Hispanic Nurses?
Of course. So, in my role as a clinical educator, I've had the privilege of helping bridge the gap between medical knowledge and practical patient-centered care. So, my primary responsibilities include designing and implementing programs that ensuring that they're updated with the latest evidence-based practices so that our patient education is comprehensive, culturally competent, and just sensitive to those that we are educating. So over the years, I've noticed that the key effective patient education is not just disseminating the information, but doing so in a way that's relatable, easily understood, and actionable for the patient. In regards to my role with the National Association of Hispanic Nurses, I have had leadership roles in both state and the national level. So I've been an active advocate for health education tailored to the unique needs and cultural nuances of the Hispanic community. So working with NAHN has provided me a platform to highlight the importance of cultural competence in nursing and health and at the healthcare industry at large. So it's crucial to recognize that the health disparities exist and they often arise from cultural misunderstanding or miscommunication. So through NAHN, I've been able to be involved in outreach programs that specifically target ensuring that they receive accurate, culturally sensitive information about their health and well-being.
Great. And you mentioned the Hispanic community, and it's so important that we focus on our community as well. So, despite smoking fewer cigarettes per day and being less likely to be daily smokers, Hispanics overall are disproportionately affected by illness that can be caused by smoking. Can you speak a little bit more about these illnesses?
Of course. So we know that the cancer is the leading cause of death among Hispanics. And while Hispanics may smoke fewer cigarettes, they're less likely to be daily smokers. And the impact of tobacco on their health remains alarming. So beyond the stark fact that cancer is the leading cause of death among Hispanics, with over 43,000 diagnoses and 18,000 deaths annually from tobacco-related cancers, smoking also increases the risk for cardiovascular diseases, including heart attacks and strokes, and respiratory diseases like COPD, emphysema, that are often exacerbated by tobacco use. So smoking can even be a predisposition to diabetes in the Hispanic community. And so these disparities could arise from genetic factors, healthcare access issues, or just a combination of both. So it underscores the culturally tailored interventions and education to address the unique challenges faced by the Hispanic community regarding tobacco use.
So, Jamie, you mentioned part of your work as a nurse is acknowledging the cultural competencies in discussing with the Hispanic populations. And we see that Hispanic populations are often overgeneralized, and there's a lot of diversity of tobacco use within the community. So, how important is it to develop tailored, culturally sensitive approaches to tobacco prevention and cessation efforts?
Well, it's definitely crucial that we're providing culturally sensitive approaches to the education and the efforts that we're providing to the community because the needs are different across the community, right? So some of the factors that are associated with post-cessation outcomes include limited access to healthcare, financial strains, and even language barriers, which I would say is one of the biggest impacts in our community, at least. So it's important that we are identifying their access to resources and also their understanding to the resources that we have.
And can you share some more of the resources nurses are provided with to support community education efforts in Hispanic communities, particularly around tobacco use and cessation?
100%. So we always want to focus on evidence-based research. So I would definitely say whenever we're using resources in the community, we want to focus on things that are from evidence-based research, right? So a lot of good resources out there. We use the NIH, the CDC, and the resources from the American Lung Cancer Association. So our partnership here as well with the campaign for tobacco-free kids. It's crucial to us getting us those resources and pushing those efforts. So with that, we're able to provide resources to reduce tobacco use in the communities, like awareness, help with cessation and control. We also provide webinars at the National Association of Hispanic Nurses to help our nurses better understand and be able to better educate the community. Our Policy and Advocacy Committee also has done work with smoking cessation and how those impact children specifically. We had a letter written to former President Barack Obama where stated health risks associated with child labor in the tobacco fields, because we know that that's another big topic as well.
Right. Thank you. And in recent years, we've seen the use of menthol cigarettes having increased among Hispanic smokers. What are your thoughts about the FDA's decision to move forward with the rulemaking to prohibit menthol cigarettes?
So the increased use of menthol cigarettes among Hispanics, it's deeply concerning, especially given the evidence that we have. So menthol cigarettes have been shown to be easier to initiate, especially for kids, more addictive and tougher for individuals to quit compared to their non-menthol counterparts. So the fact that half of all Hispanic smokers opt for menthol cigarettes amplifies these concerns when considering the long-term health impacts on the Hispanic community. So I definitely wholeheartedly support the FDA's decision to move forward with a rulemaking process to prohibit menthol cigarettes. This decision aligns with the overreaching goals of public health, aiming to protect vulnerable populations from the products that exacerbates health disparities. So as the evidence would suggest, prohibiting menthol cigarettes can lead to significant health benefits for our nation, potentially reducing or even eliminating some health disparities faced by Hispanic communities and other groups that are disproportionately affected by menthol cigarette use. So I think it's necessary for the FDA to make a move on this and step in addressing a pressing public health challenge.
Thank you, Jamie. And you've clearly spelled out what the problem is, right? So what are the next steps in addressing tobacco use and providing cessation resources in the Hispanic community? How can we collaborate and bring the community together to address these issues?
I think that some of the best ways for us to collaborate and touch on these pressing issues are, doing a lot of youth engagement, providing education and highlighting the dangers of tobacco and nicotine products. Also providing cultural relevance, right? Because developing culturally tailored materials and campaigns is necessary for us to be effective with our projects. Also some policy advocacy and getting involved more in the legislation that's affecting our communities. And then also maybe just collaborating with local advocates and influencers that are going to help spread the word in our campaign.
Well, Jamie, thank you so much for taking the time to join us today. It has been a pleasure speaking with you and engaging in such a valuable discussion. Make sure to check out the National Association of Hispanic Nurses and Tobacco-Free Kids on social media. All of our handles will be in the description below. Stay tuned for our next takedown and check out our other conversations as well. Thank you again, and I hope you have a wonderful day.